You are listening to Medscape's In Discussion series on psoriasis, a podcast where thought leaders and clinical experts share their diverse insights and practical ideas for optimizing patient care. This series is hosted by Dr. Stephen R. Feldman, editor of the Journal of Dermatological Treatment and professor of dermatology at the Wake Forest University School of Medicine in Winston-Salem, North Carolina. Relevant disclosures can be found with the episode show notes on medscape.com or the Medscape app. The topics and discussions are planned, produced, and reviewed independently of advertisers. This podcast is intended only for healthcare professionals.
Hi, I'm Dr. Steve Feldman. Welcome to Medscape's In Discussion series on psoriasis. Today, we're discuss management of psoriasis and obesity with a professor of medicine and medicine education in the Division of Endocrinology at the Northwestern University Feinberg School of Medicine. Our guest is former director of the Center for Lifestyle Medicine at Northwestern Medicine in Chicago. And as a highly respected international weight management expert, he's lectured around the world. He's author or editor of 15 books, 65 book chapters, and 200 scientific articles on overweight, obesity, and nutrition. More importantly, he's also hosted a Medscape In Discussion podcast series on obesity. If you're interested in learning more about obesity care, you can find that series on the Medscape app or wherever you get your podcasts. It's my honor and pleasure to welcome Dr. Robert Kushner to Psoriasis in Discussion. Bob, thank you.
Steve, thank you for the gracious introduction. I'm happy to be here.
Listen, I want to know how you became an obesity care specialist.
Folks in my field come to it through different avenues, everywhere from their touch personally, either they had obesity or a family history of obesity, all the way to individuals who are trained in metabolism and endocrinology and then zeroed in on obesity. I took a different path. I'm trained in internal medicine, but got interested in nutrition and diet as a medical student, went ahead and focused on that, did a fellowship in nutrition at University of Chicago, where we share some common experiences. So I come at obesity through a lens of lifestyle medicine and nutrition, and it has evolved since then.
That's great. How big an issue is obesity to people's health?
It's a big issue. It is the most common non-communicable disease, not only in the United States, but worldwide. It has now outpaced malnutrition or undernutrition. In the United States, over 40% of American adults are diagnosed or have obesity, at least by BMI. And most importantly, it has a toll on our health. It's associated with over 200 complications and comorbidities, including worsening quality of life. So it touches upon every medical specialty I know of, and here it's touching upon dermatology, and I'm not surprised. So it's a big deal, and we need to pay more attention to it.
Yes, we see a lot of obesity in dermatology. What kind of screening should I be doing in my office?
That's a great question. We shouldn't rely on obesity specialists in order to screen and treat obesity. As I said, since it touches upon every medical specialty there is, I think, and frankly, it's incumbent upon all clinicians to be aware of obesity, develop a language to use around it, which I think we'll talk about a little bit later, and provide support and care as necessary. Now, clearly, specialists are going to focus on their particular area, and it makes sense. So making the connection between obesity and the specialty area or disease that you're treating makes a lot of sense. But I wouldn't pawn it off on the primary care clinician. I would take charge of it, make the patient aware of the connection between the illness or condition and obesity, and really take it from there.
Yeah. One of the issues with that, though, is that obesity seems to be somewhat of a sensitive subject. And I know weight bias is pervasive. I noticed you've written about the need for increasing empathy, creating self-awareness of weight bias, and creating a bias-free culture. What kind of language, and maybe even more importantly, what kind of thinking should dermatologists have and use when talking to patients about obesity?
Yeah, that's a great question, and I think is a key to broaching the topic of obesity. I'm going to take it for granted that most clinicians in medicine have empathy for our patients, and this is no difference. But obesity is a little special, and words do matter. Unlike individuals with other conditions, There's a great deal of society bias, stigma, and discrimination among individuals living with obesity. So the first thing is, and I just demonstrated this to you, Steve, I used person first language. I didn't say obese patients or obese people. I use people first language, and that is individuals living with obesity or a patient with obesity. People don't want to be labeled by their condition. You can take it for granted that this is not their first rodeo. They have many other past experiences and encounters with clinicians who have not been as kind and not as empathetic, with phrases like, you need to lose weight, you need to take on more responsibility, you need to be motivated. What is wrong with you? Eat less, push yourself away from the table and move more. That is not helpful for patients. So it really begins with broaching the topic with non-judgmental language. And what we recommend is to start it by a question. And that is, it can go something like this. I've been treating you for psoriasis for several months or several years. We've been going through different treatments. We now know that having obesity or excess body fat is a risk factor for psoriasis and may actually impact the treatment that we are seeking. Is it okay if we have a conversation about obesity? So that's how I would actually bring it up, by asking permission to bring up the topic.
I have a feeling like when I know that patients' acanthosis nigricans is being caused by their obesity, do I really need their permission or is it my obligation to bring it up?
It's a good point. We don't, as an internist, I don't always ask permission to talk about their diabetes or their hypertension. But you know what? Obesity is really different. Is a different connotation and a life experience in individuals living with obesity. And what we think it does, it shows empathy and kindness and respect for autonomy, to say, can we talk about your weight now? And you know what, Steve? A patient may say, now is not a good time because I'm picking my kids up in an hour. I have to carpool. Traffic is terrible. It's not a good time to bring it up, right? It has nothing to do with you or the connotation of obesity. It's not a good time to bring it up. But by asking that kind of respect, I think you're getting buy-in from the patients to have an open-ended, non-judgmental conversation about their weight. And that's when you can then to ask them, do you know the association between psoriasis and having extra body weight? They may go, no, I don't. And then you begin with that shared information with the patient and open it up for their values, their experiences, their readiness to take on weight loss or weight management program. And then you could, again, take it from there, whether it's referral to a registered dietitian, to the primary care clinician, to an obesity specialist, or take on some of the responsibility yourself if you're so inclined as a dermatologist.
Perhaps like many physicians, I got into medicine by being really good at performing on standardized tests, not by my touchy-feely empathy skills. But I do care about my patients. My approach has been to say to people, people, different families are meant to be different sizes. I don't know if this is the right size for you or not. Is this an issue for you? Is that a reasonable approach?
Steve, if I'm not mistaken, that was a question that
Yeah.
you asked the patient. You still asked permission, but in your own words. I think the bottom line, Steve, between what you say and what I say, is remember that words matter. Patients remember those things. So if you say, you're fat, or you've got to do something about yourself, you're morbidly obese, those are really hurtful terms that that individual has listened to and heard for years, if not decades. So change the conversation to be inquisitive, be polite, be respectful, assume the autonomy of that patient, whether they wish to do something or not, and give them that opportunity. Steve, really, I think it's a win-win.
I get the sense that the advancements in treatments for obesity has been one of the most exciting areas in all of medicine. And it's so important in many ways to our health system that it's on the cover of the newspaper. Is this something I should be doing or is it something I should be referring to a specialist for?
We are clearly living in a breakthrough in the treatment of obesity. And I've been involved in this field, believe it or not, for 4 decades. And it has never been as exciting for me as someone who is seasoned in this area for what we are going through now. Everyone knows the word Ozempic, and everyone is looking for a biologic treatment for obesity. I kind of liken it to if you think about psoriasis, right? That breakthrough of the TNF alpha blockers in interleukin 17, interleukin 23. All of a sudden, every commercial is about psoriasis, rheumatoid arthritis, inflammatory bowel disease, or asthma, because you found that target that's really effective. We have done the exact same thing for obesity. We finally found the target that is highly effective, and that's called the gut-brain axis. It's harnessing gut hormones, in this case, GLP-1, other ones like GIP, that we have used for diabetes care, but now at higher doses, we're using it for obesity. And the good news for dermatologists is in diseases like psoriasis or HS or acanthosis nigricans that really will be affected and improved with weight loss. You now have a biological treatment with these medications to help patients to achieve those goals.
Should I be prescribing that or should I refer them back to their primary care, to my weight loss colleagues?
Well, here's my take on this, Steve. There aren't enough obesity specialists in order to manage the number of individuals who are in need of help for their obesity. There's about 8,000 board certified obesity men specialists across the country. And although it's growing every year, over 40% of the adult population has obesity. Not that they all need treatment, but that's the denominator we're dealing with. So we have got to identify who is competent and interested to treat obesity and not just refer. Now, if I put a hierarchical list together, I don't think dermatologists would be the highest on the list to take this on, not because of lack of skill, but really the focus of what you do with your specialty. But primary care clinicians need to take this on. Cardiologists, hepatologists, endocrinologists, some OB-GYN, pediatricians for their patients need to take this on. I think a proper role for dermatologists is to broach the topic, just like we talked about, Steve, in an empathetic, non-judgmental way. Make sure the patient understands the connection between their excess body weight and their medical problem, in this case, psoriasis or HS, which is I commonly see as well. Ask the patient what they would like to do. Are they interested in getting control of their weight? And then make that referral. It could be a registered dietitian, it could be a primary care it could be a commercial program. Maybe many of them would do well with their, or a telehealth program. So there's a lot of options. It's very difficult for them to tackle this by themselves because of the complexity of the disease and the difficulty in managing weight long term. But making sure you make a connection with a referral, I think, would be a really good role for a dermatologist.
Is there any role for me to treat or follow patients on obesity drugs?
I think there is a role. I think what you can do is continue to link the patient's weight loss management to a health outcome. All too often, patients think the health outcome is how low can I go on the scale? And they value their self-worth and every other outcome based on that. And what we need to do is focus on the health of the individual and the quality of life. So if you're seeing a patient with psoriasis and really commenting about the treatment response, the duration of response, how quickly the response is occurring, how effective the medication is with all the psoriasis markers you use, and complimenting the patient on that and reinforcing the health benefits of the weight loss, that would be very valuable.
You're really on top of psoriasis. I mean, to know about TNF, IL-17, IL-23, that's fabulous. Before we had those drugs, we had to pay massive attention to treatment adherence to get patients well with creams and things. I suspect one of the biggest potential interfaces between what you and I do is the importance of adherence to treatment. And maybe it's not as important now with some of the biologics that it was before when you were trying to deal primarily with lifestyle modification changes, which how do you get people to adhere to that?
Adherence is the key to really any management of any chronic disease. And obesity probably stands above many of them because it is a lifestyle change. Even though we're using highly effective weekly injectable medications now, like Wegovy and Zepbound, these gut hormone mimics, taking them weekly, dealing with side effects, changing of the diet so they tolerate the medication better, becoming more physically active, and thinking about this as a lifelong change, not just a short term cure, which we can't do, is very important. So we always talk about team based care, shared decision making. We use motivational interviewing. These are all these terms that, depending on when you went to medical school, you may have not been exposed to. Reinforcing the changes they're making rather than chastising them for not doing something. So acknowledging their success. And that's something that a dermatologist can also do, not only focusing on the improvement in psoriasis, which reinforces adherence to what they're doing, but also praise them for the changes they are making in their lifestyle. If I'm not mistaken, Steve, there may be some dietary factors with psoriasis as well. It may not just be excess body weight. It may be food in the environment and so on. So reinforcing that would also be helpful. And lastly, I just want to come back to the inflammation. Thank you for complimenting me on knowing about the biologics. The link most likely between psoriasis and obesity is systemic inflammation. So we're really talking about the same thing. These drugs don't directly affect the inflammatory response because they're not antibodies, but by reducing body fat and reducing the adipokines, which are inflammatory markers from the fat cell, we are reducing overall systemic inflammation.
One of the things that I believe has been the case about adherence is the focus on behavioral interventions, behavioral psychology. Whereas I've come to believe the way you get people to do things is through social interactions. People floss their teeth right before they go to the dentist. That sense of accountability you have to your provider or to others may be the biggest driver. And I could be mistaken, but I have the sense that I don't know if it was recognized within the weight management world, but I think within the House of Medicine, the only people using these social interactions were the weight management people, bringing together small groups of people who have a weight problem and them being beholden to one another, getting on the scales at the same time, tracking each other's progress. Is that the case?
Well, accountability is important. I think that's a lot of what I do when they see patients. In case patients want to please their doctor, right? They want to be acknowledged and they want to have that recognition. So that's part of it. But I really provide guidance and support and goal setting and so on. I think the early commercial programs, Weight Watchers would be an example of that, where individuals would seek a common cause and get support from each other. But I think that's true with other diseases, diabetes, juvenile diabetes, is that Crohn's disease, there's groups that get together. And we still do group support in obesity as well. But ultimately, we want to get away from what we call external accountability, right? And move it to internal values. And that's why reinforcing what the patient's goals are and where they want to go is more important than pleasing me. It's like, what do you want out of your life and your own personal quality of life?
Today, we've had a wonderful interdisciplinary discussion with Dr. Robert Kushner about psoriasis and obesity. We learned about the importance of obesity, how it's the most common non-communicable disease on the planet now, and it's associated with 200 complications. Screening should not rely on obesity specialists. In dermatology, our patients may not even be seeing a primary care provider. And so we dermatologists should have empathy when we bring this up with patients. They've been suffering with society bias, stigma, discrimination. There's just been all this awesome, exciting developments in obesity management and the gut-brain axis. Biological treatments are available now that rival the things that we do for our psoriasis patients. Rather than treat patients ourselves, it may be best for us to refer these patients to somebody with experience in the use of these treatments. And then finally, we talked about adherence, which is the key to management of chronic diseases, especially those that require lifestyle changes. If you want to know more about Dr. Kushner, check him out on the web at drrobertkushner.com. And thank you so much for joining us today. This is Dr. Steve Feldman for In Discussion.
Thanks for listening to Medscape's In Discussion Psoriasis podcast series with our host, Dr. Stephen R. Feldman. Be sure to look for more In Discussion episodes wherever you get your podcasts. Check out Medscape.com or the Medscape app for show notes, links, and more information on psoriasis.